Good morning. I'm Scott Wrighton. I serve as the city manager of Decatur. As of this morning, there have been 166 positive cases here in Macon County and 17 deaths. We have 4 new possible cases this morning. So 166 cases over the total number of tests that have been run here in Macon County, which is 1,810. That means, do the math, that about 9% of total number of tests have resulted in positive cases. That number, percentage of positive cases as a percentage of the total number of tests run, is one of our outcomes as a county and as a region that we need to drive that number down. Last month, that number was a little bit higher, so it's good news that it's come down just a little bit. Statewide, our numbers have flattened. They are no longer increasing, but they are not decreasing sufficiently either. They're flat. So there's room for optimism there, but there's also room to be even more vigilant about it. Because at 9% here in Macon County, that's still higher than the central region of Illinois. Central region of Illinois is between 6 and 7%. So we're benefiting from the region's numbers rather than the other way around, which I think makes it all the more certain and clear that we need to continue to wear masks, homemade or the store-bought kind, that we still need to practice social distancing, that we need to clean surfaces and all the other things that you've been hearing about for a long time. We need to continue to work together to bring those numbers down. That's how our region, that's how our county is able to break out and do some opening eventually under the governor's Restore Illinois Phase 3 plan, is by keeping those numbers down, and I can't emphasize that enough. So if you or a friend or a loved one have any reason to think that you might have COVID or been exposed to it, even if you don't have some of the symptoms, please call Crossing Healthcare and arrange for a test. The city has some masks. We are using them principally on our transit system, but if you need masks, you can give us a call. And the Emergency Management Agency, their offices are over on Macon Street, also has some PPE. So if your business needs those, you can give us a call. One of the other things I want to emphasize, especially to businesses that may have been shut down for a while, is that now that you're able to think about reopening and having a schedule for that, even though some of the details of it are still getting worked out, please include as part of the protocols for reopening, flushing your water systems. The city's potable drinking water supply meets all EPA requirements, but there's still some problems sometimes if it's allowed to sit stagnant for a long time in the pipes that service your business. So consider flushing those lines and making sure that all the maintenance is up to date on your water heater and any other parts of your plumbing system. We're anxious to return to some degree of new normal soon, but these sorts of preventive actions are ones that can get us there sooner rather than later. So thanks again for all of your help. We're in this together and we'll get through it together.
Hi, I'm Megan and I'm a health educator at the Macon County Health Department. And today I'm going to be talking about visiting parks and recreational facilities during the COVID-19 pandemic and how to protect yourself and others from COVID-19. Staying physically active is one of the best ways to keep our mind and body healthy. In many areas, people can visit parks, trails, and open spaces as a way to relieve stress, get some fresh air and vitamin D, stay active, and safely connect with others. So know before you go. While these facilities and areas can offer health benefits, it is important that you follow the steps to protect yourself and others from COVID-19. A few do's are: visit parks that are close to your home. Traveling a long distance to visit a park may contribute to the spread of COVID-19, as most travel requires you to stop along the way or be in close contact with others. Travel may also expose you to surfaces contaminated with the virus that causes COVID-19. Prepare before you visit. State and local authorities will decide whether parks and other recreational facilities will be open. So check with the park in advance to be sure you know which areas or services are open, such as the bathroom facility and concessions, and you can bring exactly what you need. The National Park Service will decide on a park-by-park basis whether a national park will be open. So please check with individual parks for specific details, since in many cases, visitor centers, concessions, and bathroom facilities might be closed. And if you're in a nicer area, state and local authorities will decide whether natural bodies of water and beaches or swim areas will be open. so please check with individual beaches or swim areas for those specific details. And make sure you're always practicing social distancing by maintaining a 6-foot distance and take other steps to prevent COVID-19. If a park, beach, or recreational facility is open for public use, visiting is okay as long as you practice social distancing and everyday steps such as washing hands often and covering coughs and sneezes. When it comes to staying at least 6 feet from others, know that this might make some open areas, trails, and paths better to use. Do not go into a crowded area. Avoid gathering with others outside of your household. Wash hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. Bring hand sanitizer with at least 60% alcohol to use if soap and water are not available. Play it safe around and in swimming pools. Keep space between yourself and others. There is no evidence that COVID-19 can be spread to humans through water. Proper operation, maintenance, and disinfection with chlorine or bromine of pools should kill COVID-19. But keep in mind that information about COVID-19 is always evolving as we find out more each and every day, and guidance on this could potentially change. Swimming and other water-related activities are an excellent way to get physical activity needed for a healthy life. If you are not sick or experiencing symptoms of COVID-19, it is safe to use swimming pools as long as the steps are taken to reduce the spread of COVID-19. Again, practicing social distancing of at least 6 feet from others, avoid large gatherings of more than 10 people, and keep your hands clean by washing with soap and water, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing, and use an alcohol-based hand sanitizer that contains at least 60% alcohol if soap and water are not available. And bring your mask or face covering. Even if you have the ability to maintain a 6-foot distance and you visit a park that is not crowded, it is always nice to be prepared. You may have to make a last-minute stop on your way to or from the park, so having easy access to your mask or face covering will allow you to do so. And a few don'ts. Don't visit parks if you are sick or were recently exposed to COVID-19. If you are sick with COVID-19, were recently exposed within the past 14 days to someone with COVID-19, or just don't feel well, do not visit public areas, including parks or recreational facilities. Don't visit crowded parks. Do not visit parks where you cannot maintain social distancing of at least 6 feet from others at all times. And don't use playgrounds, including water playgrounds, located within state, local, or national parks, because using these playgrounds might lead to the spread of COVID-19 due to them being crowded, which could easily exceed the recommended guidance for gatherings, and it can be challenging to keep surfaces clean and disinfected. The virus can spread when young children touch contaminated equipment and then touch their hands to their eyes, nose, or mouth. Don't use public hot tubs, spas, water playgrounds, or water parks. While proper operation, maintenance, and disinfection with chlorine or bromine should kill COVID-19 in hot tubs, spas, water playgrounds, and water parks, you should not use these facilities within local, state, or national parks at this time because they are often crowded and could easily exceed the recommended guidance for gatherings. It could be challenging to keep surfaces clean and disinfected, and the virus can spread when people touch surfaces and then touch their unwashed hands to their eyes, nose, or mouth. And don't participate in organized activities or sports. In general, most organized activities and sports such as basketball, baseball, soccer, and football that are held on parks, open areas, and courts are not recommended. These activities and sports typically require coaches and athletes who are not from the same household or living in the same unit to be in close proximity, which increases their potential for exposure to COVID-19. Thank you all for doing your part and stay safe.